Today I'm going to talk about oral cancers. Hello friends, I am Dr. Kinshuk Chatterjee. I am a head and neck oncosurgeon presently working with Manipal Group of Hospitals, Kolkata. The main hospitals in which I practice along with my team are Kolkata Oncology Hospital and Manipal Hospital, Broadway. Today I am going to talk about oral cancers. In a head and neck oncology OPD, the main bulk of patients who come to us are affected with oral cancers. Now, what are the signs and symptoms with which a patient usually comes to us? A non-healing sore or an ulcer in the oral cavity, which can be over the tongue, the cheeks, the gums, the palate, and on the alveolus, that is on the teeth-bearing portion of the mouth. Apart from these, many patients present to us with a red or a white, unusual looking patch inside the buccal mucosa or over the tongue. Sometimes they present in an advanced stage with a swelling in the neck as well. Now, these patients need to be treated, diagnosed properly with a proper rehabilitation. There is a common myth that taking a biopsy spreads cancer. Now, this is an absolutely false statement because any cancer treatment starts with taking a biopsy. Unless and until a biopsy is taken, the treatment cannot be initiated. Now, if someone after the biopsy neglects or doesn't take the treatment, then the cancer can spread. But in majority of the cases, the cancer does not spread even after waiting for a few days. The treatment of oral cancer is primarily surgical. There are other options of treatment which are used in an adjuvant setting, which means after the cancer has been removed with a surgery, in advanced cases, radiation, and in some cases, chemotherapy along with a combination of radiation is required. There are some patients who have a doubt that if they undergo a surgical removal of the tumor, a part of their tongue or a part of their jaw will be gone forever, and they will have a problem in speaking, problem in chewing, problem in swallowing. Now, this is a thing which cannot be neglected because we know the parts or the subsides of oral cavity like the tongue, the cheek, the teeth, the palate, these are all required for a swallowing or for articulation of speech. So definitely there is an alteration of these functions when surgery is done to remove the cancers. But in these days, we always have a microvascular free flap as an option of reconstruction. So the plastic surgeon in our team, they work alongside us and they try and restore to the majority of extent the functions which are lost as part of surgery. Surgery for oral cancers, or as a fact, all head neck cancers should be done by surgeons who are expert in dealing with cancers. In our team, I work alongside Dr. Saurabh Datta and Dr. Harsh Thar. We all three are trained from Tata Memorial Hospital, Mumbai for a significant number of years. And we bring the expertise that we have gained at Tata Memorial in our daily practice. The treatment for advanced oral cancer, stage 3 and stage 4, requires radiation as an adjuvant therapy along with chemotherapy in a few cases. The radiation oncologists and medical oncologists who work along with us are also experienced and are trained adequately from Tata Memorial Hospital, Mumbai. So, working together gives an edge over others who do not work together as a team. Now, a patient who undergoes surgery with or without a radiation or a chemotherapy should always be under follow-up, and this follow-up, the frequency of the follow-up varies. For the first 2 years, the follow-up schedule is for every 3 months we see the patient once. If everything works fine, the patient doesn't have any sign of a disease coming back, for the next 3 years, we see the patient twice a year and thereafter annually once. The reason for this strict and vigorous follow-up schedule is even if a cancer recurs, it can be picked up early, and in today's era, there is treatment for a recurrent cancer. It is not that if a patient have a cancer recurrence, he or she cannot be treated. So hence is the need for a regular follow-up. Now the patient should be aware of the fact that if they miss a follow-up, they are actually endangering their life. Because if someone skips a follow-up and comes after a year, maybe the recurrent cancer has attained a stage which might not be curable at that point. So, never overlook the symptoms which I have mentioned. Consult your head and neck surgeon, get your biopsy done, get the treatment early, and be cured. Thank you.